Hey everyone, it's Dr. Crockett with Utah Spinal Works from Highland, Utah. This month we're going to be talking about sciatica, so the sciatic nerve pain, kind of what it is, what it does, how we can diagnose it, and how we can treat it, manage it either at your house or by yourself or with a professional. So first off, let's start with what is the sciatic nerve. So the sciatic nerve is made up of 5 nerve roots. So every level of your spine has a nerve root exiting it. So the sciatic nerve is made with L4, 5, S1, 2, and 3. All 5 of those connect together down by your hip and make this really thick nerve, and that's your sciatic nerve. It goes down to just above the knee and then it splits. So when you have sciatic problems or sciatica, typically it's either at the L4, 5 or it can be at where they all connect, kind of by the piriformis, or it could also be the nerves getting trapped in this SI joint. So we would have to determine what's causing the pain and where it's coming from in order to give a good diagnosis and good treatment plan. So now that we know what sciatic is, we need to know how to diagnose it. So the main thing we use to diagnose it is presentation, history, and orthopedic exams here in office. So presentation, if you have pain that starts in the back, kind of radiates down the leg, through the buttock and really past the knee, then that's a good sign that you have sciatic compression somewhere. If it's kind of just like achy in the low back and it doesn't really radiate anymore, some people call that sciatica. It's probably something with the SI joint. So we'd have to differentiate that for sure. Also, other signs would be burning, numbness, tingling, kind of weakness down into the one side. And typically sciatica is just one-sided. If it's both-sided, that's rare, but it could happen as well. And then we would do some orthopedic exams. So essentially we would either stretch the nerve, compress the nerve, or kind of poke at it and see what happens, and see if it irritates it. If it does, that means that you have sciatica, and then there's some treatments that we can do here in office, and we're going to show you those treatments. Okay, so one of the first things we would do here is cupping. So the cups, they're just going to go on the skin, and it sucks that skin up, and it allows for healing factors, so blood to pool to the area. That blood brings in some white blood cells, which help clear out inflammation and fix the issues. So I really like to utilize the cups kind of on the low back with all like sciatic and low back. Another thing that we're going to use is some tools. So this is an instrument assisted, just kind of soft tissue. We use some topical analgesic that we have here, some Recover cream. It does have CBD in it, but it just kind of cuts through all the pain. So we would just kind of put some on the back and scrape out the fascia. So this is a really, really good method just to kind of alleviate all back pain, tension, stuff like that. And if there is any tension on that sciatic nerve caused by any musculature or tight fascia, then this will break it up. Okay, we'll also utilize some chiropractic manipulation or adjustments here. So we do it one of 2 ways. I like to use the drop table, especially if it's a recent injury or what we call a hot disc. And essentially the table will drop down and it allows us just to do a much gentler adjustment in the area that we need, and it would kind of look like this. The other way we can do it is we can have them on their side, and a lot of people like to do it this way because it does get a lot of relief. But this would be the side posture where we're just adjusting like that. And so we would do those. They're very gentle. It's designed to help move the joints and get more hydration to the discs. So that's just a little bit about sciatic pain, kind of what it is, how to diagnose it, how to treat it here in office. We're going to go over the decompression machine, which is a huge component of alleviating that sciatic pain and getting more space in the discs. And also we are going to do some exercises that you can do at home, so keep following along for those. If you are experiencing any low back pain, sciatic pain, and you want to get it checked out and you live close by to Highland, give us a call at 801-770-4333 or visit us online at utahspinalworks.com.